An extremely common complaint that I see with anybody who's got hip impingement, aka FAI, is SI joint pain. Okay, that's pain in this region. It's like right about here in the low back. Okay, I wanted to kind of explore why this might occur. So the hallmark sign of hip impingement is pain with hip internal rotation. So that looks like this. That's this motion here. That's internal rotation of the hip. And you might say, well, I don't really do that. Okay, well, do you ever shave the back of your leg? Do you ever squat and your knee kind of comes in a little bit? That's hip internal rotation. Are you a golfer, or playing some sort of rotational sport? Or maybe you're just squatting a lot, like a CrossFitter. All these things will expose that lacking hip internal rotation. And just a general principle of the body, if you're missing range of motion in one joint, the neighboring joint is going to have to pick up some of that slack. And in this case, if the hip is missing internal rotation, the next joint up is your SI joint. And this is not a joint that has a lot of movement. It's got millimeters of movement, so it doesn't take very much to kind of set this thing off. On top of that, you could have some underlying SI joint issues. I'll cover that in a different video, where you have imbalances of the muscles that attach to the pelvis, or a weakness issue in the hip abductors.